Trintellix, Vortextine. My name is Belinda Addo, and I'm doing my presentation for Brandman University, Psychopharmacology Across Life. Trintellix, Vortextine, can be given in 5 milligrams, 10 milligrams, and 20 milligram tablets. Trintellix, formerly known as Brintellix, is a medication used to treat major depressive disorder. It's classed as an antidepressant. The recommended dosages are starting Trintellix is 10 milligrams, administered orally once daily without regard to meals. Dosage should be increased to 20 milligrams once daily as tolerated. Provide overall relief from major depressive disorder. It's a prescription medication used in adults to treat major depressive disorder. It helps reduce the multiple symptoms of major depressive disorder based on an overall score on a standardized depression rating scale. DSM-5 major depressive disorder criteria include depressive symptoms greater than or equal to 5 symptoms during the same 2-week period that are a change from previous functioning. Depressed mood and or loss of interest, pleasure must be present. Exclude symptoms clearly attributable to another condition. These depressive symptoms may include depressed mood, loss of interest and pleasure, weight loss or gain, insomnia or hyperinsomnia, psychomotor agitation and retardation, fatigue, feeling worthless or excessive inappropriate guilt, decreased concentration, thoughts of death or suicide. Required criteria: they must have all 4 plus the greater than or equal to the 5 depressive symptoms that we discussed earlier. Symptoms may cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. Episode is not attributable to physiological effects of substance disorder or another medical condition. Episode not better explained by schizoaffective disorder, schizophrenia, delusional disorder, or other specified or unspecified schizophrenia spectrum, or other psychotic disorders. No history of manic or hypomanic episodes. Exclusion does not apply if all manic or hypomanic episodes are substance-induced or attributable to psychological effects of another medical condition. Some of the side effects of Trintellix may cause serious side effects. Trintellix may cause serious side effects, including serotonin syndrome, increased risk of bleeding, manic episodes, discontinuation syndrome, eye problems, low levels of salt or sodium in the blood, or adverse effects. The most common side effects of Trintellix include nausea, constipation, and vomiting. How to take the medication. Trintellix can be taken either in the morning or at night. Common side effects are restless boost of energy and insomnia. If this happens, you should try taking Trintellix in the morning. Black box warnings. Suicide. Increase the risk of suicidal thoughts and actions in children and young adults. Bipolar disorder, mania, unusually elevated, irritable, or energetic mood. Bleeding disorders. Increase the risk of bleeding episodes such as nosebleed and stomach bleeding, or glaucoma, closed-ankled glaucoma. Case Study A. CH is a 54-year-old female CNA who presents to clinic. She has been widowed for the past 5 years, has 3 adult children who live out of state but maintain a close relationship with them. She works as a CNA for the past 20 years. Since the pandemic, she has witnessed the death of 15 residents, which has taken a toll on her mentally. Her past medical history includes hypertension and depression. Currently taking amlodipine 5 milligrams and Zoloft 100 milligrams. Has been experiencing increase in depression for a long time. Easily irritated, anxious, doesn't leave her home except to go to work, no longer enjoys her normal activities. Her HPI, the patient presented to the clinic today complaining of increased depression. She is more agitated than usual, pacing back and forth, and is demanding for a change in her medication. Patient is also complaining of constant seating, which is becoming very embarrassing when in public, somnolence, and decreased appetite, all of which started with her current medication. She's unable to maintain relationship, and she tells me that her job has issued her a warning letter for missing multiple days at work. Clinical Global Impression Severity Scale score of a 6, PHQ-9 depression rating score 20/27, indicating severe depression. Her score 2 months ago was 16/27, so there's been an 80% increase. On her mental status exam, she's oriented to place and time. She appears at her stated age disheveled. Eye contact is shifty. Her behavior is agitated and concerned. Her attitude is angry and cooperative. Her rapport is candid and easy to establish. Her speech and language are clear with normal rate, rhythm, and volume. Her mood is severely depressed. Her affect is congruent with her mood. Thought process and associations are logical and goal-oriented. Her thought content is noted delusional thinking, believes everyone is against her. There's no suicidal or homicidal ideation. Her cognitive function was not assessed, but was within normal limits. Her concentration was within normal limits. Her MSSE is 30 of 30. She's got fair insight and good judgment. Her vital signs are normal. Her differential diagnosis is major depressive disorder or severe with psychotic features. The treatment plan for her, for the pharmacological, based on her patient's complaint and history, Zoloft will be discontinued and the patient will be started on Trintellix, 20 milligrams daily. The rationale for the change is Trintellix as a second therapy for those who fail to have adequate response to SSRIs like Zoloft. Studies have shown that this medication is better tolerated and does not cause sweating, somnolence, or decreased appetite. Pharmacotherapy. Consider individual psychotherapy for the patient. Encourage the patient to engage in social activities and make meaningful interpersonal relationships. Case Study B. KS is a 43-year-old single woman living with her parents, works as a financial advisor to a private company. Her psychiatric complaints were depressed mood and hedonia, pessimism about future, fear and distrust, inability to make decisions, irritability, and occasional distress. Patient had a dysthymic and vulnerable pre-morbid personality. She presented to several psychiatrists and was prescribed various antidepressants, most recently partially treated with fluoxetine, 20 milligrams daily. Since her complaints were still present, we discontinued fluoxetine and started her on Trintellix, 5 milligrams a day, and increased dosage of Trintellix to 10 milligrams a day at the second week of her treatment. In the third month of Trintellix therapy, patient started complaining from excessive itching in her legs and other parts of her body, and edema, petechiae, and ecchymosis at her legs. No significant lab abnormalities, including CBC and hematological panel, have been found. The patient was not taking any other medications nor consumed any foods which might have caused any allergies. Patient was consulted with the dermatologist and the formal diagnosis was drug-induced allergy. Trintellix was discontinued immediately, and in her next follow-up examination it was replaced with 30 milligrams of duloxetine a day. Patient's complaints were resolved following this. The patient had a score of 6 on a Naranjo Adverse Drug Reaction Probability Scale, which indicated a probable relationship between the dermatological adverse effects observed during the use of Trintellix. Her mental status exam. Her orientation was normal to person, place, and time. Patient appeared at her stated age, neat in dress, and eye contact was shifty. Her behavior was stoic and concerned. Her attitude was pleasant, cooperative. Her rapport is candid and easy to establish. Her speech and language was clear, normal rate, rhythm, and volume. Her mood was moderately depressed. Her affect was congruent with her mood. Her thought process associations were logical and goal-directed. Her thought content was goal-directed and logical. No thoughts of suicide or homicidal ideation. Not formally tested, but grossly within normal limits for cognitive function. Her concentration was within normal limits. Her MMSE was 30 of 30. She had fair insight and good judgment. Her vital signs were within normal limits. Her differential diagnosis was major depressive disorder. The treatment plan in this case is based off of the patient's complaints and history. Trintellix will be discontinued, and the patient will be started on duloxetine 30 milligrams daily. The rationale for the change is Trintellix was the primary therapy medication, only medication patient was using at the time. Due to serious dermatological adverse effects, we'll discontinue the medication and switch to duloxetine. Pharmacotherapy. Consider individual pharmacotherapy for the patient. Encourage patient to engage in social activities and make meaningful interpersonal relationships. These are the references used for this presentation.